Hi, this is Dr. Nemechek of the Nemechek Protocol. I want to talk to you about headaches, kind of my simple way I look at things. There's kind of three main sources for headaches that people have. One are the headaches that really emanate from the front of your face. These are often easily kind of correlate with your sinuses or a dental problem, things of that nature. The other headache type can be actually from orthopedic issues in the neck. And so if you have really a severely damaged vertebrae or a herniated disc, you can get some projection up in there. But those two are very minor compared to the primary cause of most headaches. And what we're understanding is most headaches are due to the inability to generate blood pressure up to the top of your head. Okay, I've talked about this with in context like brain fog or ADD, lightheadedness. When we stand upright, one of the biggest challenges that your autonomic nervous system has is to drive blood pressure up to the tip of your head. And so like people who are lightheaded, when they stand upright, if their autonomics don't work right, their pressure drops and they feel this kind of lightheadedness. All right. Now some people don't have it so intensely, but what they'll just have is this lowish blood pressure up there. Now, if you watch my video on coat hanger pain, you'll understand that you can have lack of oxygen into the neck muscles, and it can make the muscles just tight, okay? Or it can make them hurt, right? If somebody has a narrowed artery to their heart, they get what we call heart pain or angina from lack of oxygen reaching the muscle not getting enough oxygen. Well, the same thing can happen in the neck. That's called coat hanger pain. Well, the very same thing can happen to your scalp muscles. Along the sides, it can be the back, it can be projecting up, it can be one side, it can be the other side. The pain can be excruciating. You can actually get some pain in the jaw muscles, a tightness. Sometimes people are misdiagnosed, or maybe it's the cause of TMJ. But very, very commonly, the pain in the scalp and head is from autonomic dysfunction where you can't generate enough blood pressure. Now, what kind of other things would you notice if this were the case? Well, a lot of people, if they go lay down flat, they get some relief. They got a really bad headache. I just got to go lay down for a while, and it seems to get better. Maybe not completely, but it improves. That's because you got rid of gravity, okay? And you're laying flat. It's easier to get oxygen to the muscles in the top of your head. Or some people will tell me, as long as I'm active, I don't get a headache. Because when the blood's not getting to the top of your head, it pools in your leg muscles, and when you move your leg muscles, it generates pressure to your head, so you get better oxygen. Or some people will notice when you wake up, they have no headache, okay? But after they get up out of bed, maybe within 15, 30, 45 minutes, they start noticing their headache coming on. It gets worse because they're starting to lose the battle already against gravity and their pressure's dropping. Okay? And then other people, it's not so bad in the morning. As they go through the whole day, though, they're losing this battle over time. They're at work, they're getting tired. They may get thirsty for something salt or sweet because that'll boost blood pressure to their head. They start getting a headache. Or they get the headache if they don't drink something salty or sweet, to boost blood pressure to your head. And so, so very commonly, it's autonomic dysfunction causing your chronic headaches, as long as you don't have severe orthopedic problems in the neck and you aren't having obvious sinus problems, for instance. Now, one of the things with sinus headaches is a little clue is they'll often wake you up when you're flat. And they can often get better when you're upright because the sinuses will drain after a while and open up. So that's a little clue that's kind of the opposite from the low blood pressure problem. Okay? So to make this better, you got to balance your gut with inulin and rifaximin if you're an adult. You need high doses of DHA. You need plenty of that genuine California olive oil to get your nervous system working again. That's all for today. This is Dr. Pat Nemechek of Nemechek Autonomic Medicine, Buckeye, Arizona. Have a great one.